Hello, my name is Elizabeth German, and this is Professional English in Use Medicine, chapters from 5 to 13. Write sentences to describe the work of the specialist in each branch of medicine. Look at the opposite to help you. 1. Dermatology. A dermatologist specializes in diseases of the skin. 2. Rheumatology. A rheumatologist treats joint and autoimmune disorders. Traumatology. A traumatologist manages injuries from accidents. Pediatrics. A pediatrician cares for children health. Obstetrics. An obstetrician oversees pregnancy and childbirth. Complete the table with words from A, B, and C opposites in related form. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Specialize, specialist, specialization, practice, practitioner, practice, consult, consultant, consultation, assist, assistant, assistance, graduate, graduate, graduation, qualify, qualifier, qualification. Find prepositions in C opposite that can be used to make word combinations with the words in the box. Then use the correct forms of the words to complete the sentences. We have good, interested, specialized, work. 1. A pathologist specializes in diagnosing disease through examining cells and tissue. 2. A pediatrician must enjoy working with children. 3. An oncologist is specialized in the diagnosis and treatment of cancer. 4. A physiatrist must be interested in counseling. 5. A neurosurgeon must be good with her hands. Make word combinations using a word from each box. Two words can be used twice. Look at A, B, and C opposite to help you. Consulting rooms, general practitioner, group practice, health center, internal medicine, surgical specialties. Unit 6. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Associate specialist, house officer, on call, provisional diagnosis, radio pager, wire round. Match the descriptions with the job titles. Look at A and B opposite to help you. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. C. Consultant. 2. Dr. Stewart has just started the second year of her foundation program. D. SHO. 3. Dr. Side has started his training as a surgeon. Specialist register. 4. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. E. PRHO or house officer. 5. Dr. Miller is in charge of the medical staff in the Birmingham Hospital. B. Medical director. Are the following statements true or false? Find reason for your answers in A, B, and C opposite. A medical graduate becomes registered 2 years after graduation. False. The system of training doctors in Britain is called the Foundation Program. That's true. The name senior house officer is no longer used in Britain. False. The consultant is usually the first doctor to see new patients. False. When working in shift, all doctors make turns to be on call. False. Complete the test of a PRHO describing her job. Look at A, B, C, and opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the church nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I clerk any new patients, which basically involves taking a history. On Tuesday and Friday mornings, the consultant does her work round, and I have to make sure I'm completely up to date on her patients. After that, there are usually a lot of things to do, like writing up request forms for blood tests and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They're usually happy to be going home. And then, of course, there are lectures and tutorials in the foundation program on Monday and Wednesday. Unit or Chapter 7. Complete the sentences. Someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurse is a clinical support worker. Someone who is not qualified but is able to assist nurses is a nursing auxiliary. A nurse who has qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. A nurse who looks after a ward is a church nurse. A nurse who works in the community is a district nurse. Someone who answers the ward telephone is a ward clerk. Make word combinations using a word or phrase from each box. Look at the opposite to help you. Carry out a procedure. Change a dressing. Check the temperature. Give an injection. Remove sutures. Complete the sentences with the correct grammatical form of perform. An isotope brain scan is a painless and easy to perform. Biopsy or biopsy of the pancreas was performed last March. If the patient's condition deteriorates, a laparotomy shall be performed. If a diagnosis of meningitis is suspect, a lumbar puncture must be performed. Last year, we performed a randomized double-blind group study. Complete the sentences with the correct grammatical form of carry out. I now intend to carry out a larger study. Unfortunately, few properly controlled trials have been carried out so far. A number of studies have been carried out recently to look at this question. Outright hemicolectomy was carried out and the patient made a full recovery. This procedure can be carried out in the emergency department. Chapter 8. Make word combinations using a word from each box. Ambulance technician, artificial limb, club foot, contact lens, health professional, intraocular pressure, occupational therapist, social worker. Which allied health professional could best help the following people? A young unmarried woman who has just had a baby. Social worker. A woman who is having difficulty using her right arm following a fracture. Physiotherapist. Someone who needs glasses. Optician. An elderly woman who has had a below knee amputation. Prosthetist. A man whose wife has Alzheimer's disease. Social worker. A man with a fungal infection of his feet. Chiropodist. Complete the tests. Look at A and see opposite to help you. A prosthetist works with patients of all ages. As a member of a clinical team based on a large hospital, the patients may need a prosthesis as a result of an accident or amputation following a disease such as diabetes. Alternatively, they may have been born without a limb. The orthotists work alongside doctors, nurses, physiotherapists, and occupational therapists to give the people under their care the best possible treatment. Their main aim is to enable the patient to lead a normal life at work and leisure. An orthotist often works in a clinic as part of an outpatient service and also visits other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require orthosis to help them walk, and many older people need a special shoes to correct deformity. If damage any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to relieve pain. Chapter 9. Complete details with the words from A, B, and C opposite, with a stress mark in front of the stress syllable each word. Admit, admission, assess, assessment, discharge, discharged, operate, operation, refer, referral, treat, treatment. Make word combinations using word from each box. Look at C opposite to help you. Acutely ill. Assessment unit. On duty. Referral letter. Waiting list. Which hospital department will be the most appropriate for the following patients? A woman in a diabetic coma. Intensive care unit. A patient who has just had a radical prostatectomy. High dependency unit. A patient who is to have a skin lesion removed. The surgery unit. A man with a foreign body on his side. Casualty. A woman with a threatened abortion. Gynecology emergency. Complete the astral form an information leaflet for patient information for all patients. When you arrive at the hospital, please tell the receptionist who will welcome you. Check your details and direct you to the waiting area. The length of your visit will depend on the treatment you're going to have. You may need to have some tests, such as an X-ray, which could mean going to another department, or you may be referred to other professionals, such as a physiotherapist or dietitian. You may need to revisit the clinic. If staff at the clinic want to see you again, another appointment will be arranged for you. If you need to be admitted at, to hospital for more treatment, either as an inpatient or for day surgery, you will be told when, is, when this is likely to happen. If you do not need further treatment, you will be discharged to your GPS care. To your GP's care. 10. Complete the sentences. Look at A opposite to help you. Children over 60s and people with some chronic disease do not have to pay the prescription share in the UK. Patients with mobility problems may be unable to go out. They are housebound. The average GP appointment is 10 minutes long. A locum GP is someone who takes the place of a staff member who is on leave. Care outside working hours is known as out-of-hour treatment. Make word combinations using a word or phrase from each box. One word can be used twice. Change dressings. Make appointment. Make home visits. Perform a minor surgery. Refer a patient. Run a clinic. Supervise staff. Take messages. Which member of a practice team will be responsible for each of the following? Running a clinic for pregnant women, midwives. Teaching a patient how to straighten his broken leg, physiotherapist. Letting the GP know that a patient can't come to her appointment, receptionist. Running a clinic for people who want to lose weight, practice nurses. Visiting a patient who has just returned home after a hernia operation, district nurse. Carrying out checkups on children in a poor neighborhood, health visitors. Organize and cover for an absent doctor, practice manager. Complete the diary for Dr. Stewart afternoon. Look at A and see opposite to help you. 1 to 2 p.m. Practice team meeting over sandwich lunch. 2 to 4 p.m. Afternoon surgery. 2 12 10 minutes appointment. 4 to 4 20 p.m. Sorry, 4 to 4:20 p.m. Coffee break. 4:20 to 5 p.m. Check with reception for messages due with home. Visitors and repeat prescription request. 5 to 6 p.m. Paperwork, e.g., referrals to secondary care, admin task, telephone calls to patient, private medical examinations. 6 p.m. Phone switch to W08 service. Match these activities to the stages of medical education in the UK given in A opposite. Dissecting cadavers, undergraduate. Keeping a log of surgical procedures observed and performed, postgraduate. Working for 4 months in accident and emergency to experience this specialty foundation program. Taking a 4-week attachment in obstetrics and gynecology, undergraduate. Taking an online course on recent developments in cardiovascular disease. Continuing professional development. Complete the sentences. Just before their final year, students have the chance to take an elective in a hospital of their choice, anywhere in the world. Problem-based learning contrasts with an approach where each subject is taught separately. These days, lectures are often interactive, with regular opportunities for the students to ask questions. In clinical attachment, students learn how to treat and manage patients. Students select models can be a topic from outside medicine, such as a foreign language. Dissection of cadavers is an important part of the anatomy component. The medical school at the University of Edinburgh is one of the oldest in the UK. She is a consultant at the Royal, one of the leading pediatric heart specialists in the country. The Royal College of Surgeons in Edinburgh dates from Jesus, 1505. We have seminar each week where we discuss topics in a small group with our lecturer. Match each of these activities to one of the components of the undergraduate course describing B and C opposite. Julie spent 6 weeks working in a small hospital in the Himalayas, overseas elective. A group of students discussed together the possible reasons for abdominal pain after meals in a novice 44-year-old male, problem-based learning. A small group of students traced the pulmonary artery in a cadaver dissection. Otto spends a month working in the pediatric ward of the local hospital, clinical attachment, and learns how to take blood from an elderly patient. Vocational studies. Juma chose to study travel medicine in his 4th year. Students select models. Complete the phrases with verbs from the box. Assess, deliver, demonstrate, provide, supervise, take. 1. Demonstrate a competence or how to do something. 2. Supervise a trainee by ensuring the successfully completes her training. Provide a course or a training program as a teacher. Take a course or training program as a student. Access, progress, or competence.